Okay, now it's preparing, setting up, YouTube Live. Okay, so now we're live on YouTube at the same time. So Belle, can you send me the link of
Okay,
these
I'm
YouTube,
checking.
please? Yeah, thank you.
So-
Yeah. Then we can start to admit people.
Okay, I sent you the link in both
From chat, right?
chat and also WhatsApp.
Okay. I didn't see it yet. I didn't see it yet from chat.
And
Is there
WhatsApp?
anything I need to do? No.
No. It's okay. You are the guest speaker. So where is the link? I didn't see it yet. Do you put in the chat box for me?
Both chat and
Yeah, I see it on YouTube, on WhatsApp, but it doesn't help that way. If you can give me the link here.
can you see it?
It's weird. No, I don't.
In WhatsApp, can you?
Yes, but I don't see it here. Maybe you send me an email. So I
Okay,
here open it, no one see it. Yeah,
okay.
okay. So let's go. I will start to admit everyone now.
Okay.
Hello, everyone. I hope you hear me well and welcome to this schema therapy for children and adolescent webinar. So in case you don't hear me very well, please, feel free to check out our message, text us in the chat box, and feel free to switch off your camera if that's better for you. Okay, because we receive so many registrations, so at the same time we are going on live. That's why I remind you, feel free to switch off your camera because otherwise your visual image would also go live. So just a reminder. So thank you for coming in for this CSTA's activity event. I'm Beatrice and Kessler, so I know quite some of you right here. Very happy to see you. And we are very honored to have our guest, Dr. Christoph Luss from Germany to join us today. So now
Thank
I'm
you.
going to give a brief introduction about Christoph. So bear with me, Christoph is a very senior colleague in schema therapy, I would say. So Dr. Christoph Lutz is the clinical psychologist and psychotherapist for children and adolescents, and he works in his own private practice in Germany. So he is also an advanced certification for individual schema therapy and train supervisor and trainer, and he's also the supervisor and trainer in schema therapy for children and adolescents. He was in the chair of this children and adolescent committee within the ISST in 2013 to 2017, and also 2023 to 2025. So since then, 2025, um, Christoph is also the ISST specialty coordinator in the schema therapy for children and adolescents. And he is also the life honorary member of ISST. And he published a very classic book, like everyone, if they learn schema therapy for children and adolescents, everyone referring to this book. So when you look at our registration form, we already put the book there to let you know. So in case you want to read his book before. And he conduct workshop and seminar all worldwide everywhere. So I'm very happy to have Christoph to join us today. So I hand it to you, Christoph.
Thank you so much, Beatrice, for this lovely introduction, and welcome everyone. So I feel really honored to have some time to share with you some ideas how to adapt schema therapy for children and adolescents and their parents. So we will have about 40 minutes for my presentation. And if you have any questions, please feel free to express them in the chat. Or later on, we will have about 15 minutes for questions and answers. And yeah, if you have some, just take a note that you remember when it's time to ask. I will share my screen with you, so that should work, hopefully. Yeah. And yeah, it's a free webinar that my goal is actually to give you an idea what is schema therapy for children and adolescents like. So how does it work? So it's more to focus on the practical approachment and less theory, though the theory is important. And I will address some slides to shed some light on the main concepts. Yeah, what is schema therapy? Probably you know already, but just a first definition. So we understand it as an enhancement and further development of cognitive behavioral therapy. So it belongs to the third wave. And schema therapy is very prominent in adult schema therapy or adult psychotherapy, but it is also more and more applied and favored for children and adolescents. And what we do is we integrate to the CBT approaches certain techniques, approaches that are stemming from psychodynamic, hypnotherapeutic, and gestalt therapeutic techniques. So there are also more approaches meanwhile, but these are the main roots, actually, what we use. What do we focus on? We think we have to integrate more the emotions than it's usual that we used to do in CBT. So we focus a lot on emotions, and we think the relationship is really crucial, is key to work really on emotional issues that are maybe filled with shame or effectiveness, for example, so that we really are well advised to invest time in the relationship building. And of course, when we work with children, we have to apply child or age appropriate techniques. So we need a psychoeducation that the children may understand. So not too difficult, but nevertheless, deeper going than just talking or about cognitions or behavior. So we focus a lot on schemas, modes, and needs, and this is a tricky or sometimes complex concept, and the question is how to provide an explanation model that children can understand. That is not easy, actually, and therefore it makes sense to take a closer look to the child and adolescent schema therapy. And of course, children, the most important people for children are the parents. So we are also providing help to parents who are triggered by themselves. That's sometimes happening, that honestly speaking happens often when children show any dysfunctional behaviors, that the parents are triggered, and then they tend to emotionally over-respond. And this is not because they are bad parents. This is probably also because they are triggered from their own schemas or their own childhood memories pop up, and then they have problems to raise the children as they actually wanted. So we come back at the end of my presentation to the parents. In general, I think cognitive behavioral therapy is really good and really helpful, but we also have clients who do not benefit from these CBT approaches. And if you work with children and adolescents, you sure have the experience that some problems exist for many years, and we try our best, but for some reason it is difficult to get rid of these problematic behaviors. So that would be one indication where we think probably CBT is not enough. It's good, but not enough actually to get to the core of the problem. And we notice that when, for example, we experience a high vulnerability in the client. So it's really, really sensitive. And this is something what we observe sometimes, that they are really hurt, easily hurt. And yeah, of course, this is a problem, and it's not easily treated by cognitive techniques when we notice there's so much hurt feelings, so many hurt feelings actually activated. The question is, where does it come from? And, you know, schema therapy, we focus on the biography. So what did they learn and what kind of experience they had before? So we talk about the schemas or wounds. This is a metaphor we often use, a wound. I will show you in a picture later. Yeah, another indication is when the same mistakes occur over and over again. So the child may have understood the problem, and they really don't want to show the problematic behavior, but it happens nevertheless. And it's probably necessary to go deeper. And when we go deeper, we have this main architecture in schema therapy, where we would say the platform, the most important thing is actually the relationship building. So I will show a slide and a note from Jeffrey Young later. So we invest a lot in the fundament of the relationship. And then we have these four main concepts. And the main concepts are the emotional need. Sorry. So the emotional need model, I will explain. And we were dealing with the concept of early maladaptive schemas. We will talk about coping styles, and finally the mode model, which is the most prominent or most important model we work with. Okay, let's have a look on the relationship building. Just briefly, we invest a lot in the relationship by talking about positive things. So strengths, resources, achievements. And this is a way actually to make the client understand we really appreciate what they have managed so far. So let's say 1, 2, 3 sessions, we work only on the resources. And the main point is that we are students of our clients. So of course we have studied, and maybe you have a degree, a doctorate degree, but it doesn't matter. The real professional, the professor, is a child or the adolescent. And we are learning from them. And this is actually our basic attitude, that they really understand we are grateful for their coming, and we are grateful that they help us to understand what they think, what they feel, what they need. And so these are the master, and we are grateful to learn from them. And when we do that, we we follow Jeffrey Young's statement here. He says the relationship building is a main agent of change. It's a main agent of change. So it's the most important factor. So that's why we think CBT is good, but the emotional competence might be not sufficient, actually, or might be not enough to make the client understand that he's really welcome. He is fully accepted with all our empathy, warmth, authenticity, patience, and so on. So this is a really crucial thing. And this is what the child or the client feels. The client feels how we think and feel about them. So we cannot hide that. Actually, it's actually our way to look at the positive things first. And here we have the central message, now you matter. And I'm so glad, I'm so happy you are here to better understand what brings us together and what's the background and so on. Okay, so 1, 2, 3 days, we usually talk about resources, but we need to explain to the parents, of course, when we do that, that this is part of the therapy. This is not just reframing or it's just belittling the problems. It's just the preparation to talk about later, after this phase of relationship building, to talk about later about the deeper going problems. And this is necessary. So if we start too soon with a problem talk, then probably we will find a detached protector mode in the children, or they simply not open, or they have some blockades. Okay, so relationship building is a fundament, and then we think about the emotional needs of our client. So what do we mean with that? So we would say every human being has needs, core needs. They are existential needs like safety and health. And we also have emotional needs. And we follow here this structure. You can see attachment and autonomy, self-worth and pleasure and fun or stimulation. And in the center is the need for structure and orientation, more or less rules or clear structure. What is okay, what is overstepping. So, and what is my role, what I'm allowed to do, what are my rights, what are my duty. So this is all gathered in this need for identity, structure, limit setting. Okay, so these are the needs, and in our understanding, when these needs are frustrated, unpleasant emotions will occur. So some people say these are negative emotions. We would say there is no negative emotion. All emotions are positive because they tell us something. They have the job to let us know something is wrong. So the emotions are never wrong. The emotions are just a mirror of frustrated or frustrated needs. And if we have a client who is very sad or very anxious or very angry or feels ashamed and so on, then these are welcomed messengers to let us know something's wrong. And when these needs are inadequately met, again and again, many times, so during the childhood, it makes sense that this leaves its marks on someone. And these marks we call patterns or schemas. So a schema is actually the residence of frustrated needs. So it's a summary, it is a basin, it's a summary of past frustrated needs. And Jeffrey Young defined it as a pattern, theme, which is broad and pervasive and often deals with relationship issues. And now the point is crucial. They are developed during childhood. So maybe you're treating adult clients as well. And what you do in schema therapy is you talk about their childhood. So you talk about this time phase, in which the children are that are coming to us with their problems. So the point is that we want to help them to prevent, or actually to provide them these needs, what they need, in order not to build up these maladaptive schemas that comes later in their life. So we want to actually understand the children and their families and what they need. And if we don't do that, these constant need frustration or schemas become stronger and stronger. And that is a problem that they do not heal from by themselves, actually. So a schema needs often healthy coping strategies, and that are not, these are not so easy to find. And even for adults, it's difficult, even the more for children. And that's why we think the children need help, sure, but also the parents or parental caregivers are needy to understand what their children needs. When we look at the maladaptive schemas, we can say this is a conglomeration of memory and cognition. So this is more a rational half. Aaron Beck, cognitive behavioral therapist, he also defined schemas, but he had a more cognitive approach. And Jeffrey Young, he extended, or he placed more emphasis on the emotional part, actually. And when we talk about these schemas, these early maladaptive schemas, we think of primarily actually of the emotion and the body sensation, what's going on emotionally. Of course, there are also thoughts and cognitions, but when a client is triggered, then he is more or less flooded. Actually, he is flooded by these emotions or by the past experience. And you can see that here in the picture, that he might be really overwhelmed or flooded. And this is really, really a painful moment when schemas are triggered, emotionally painful. Let me show it in pictorial representation. So we would say every child and every human being has needs. So these are the core needs. And if these needs are met more or less, they can build up positive schemas, positive buttons. And this is also an important point where we try to help children to foster their positive schemas. So these are the positive things like optimism, competence, or certain positive schemas. And we have the metaphor of a button. Someone activates a button, for example. But what happens if this schema, these needs are frustrated again and again? That leaves its marks. And here we have the metaphor of the wound. And in case that there's a situation which is in some way hurting, frustrating, threatening, this wound is activated, is actually, so the client feels the pain actually also from the past. And the emotion and body is responding. And also cognitive or neural systems in the brain are activated, and they look as like with glasses on the situation. And this is actually our metaphor for a schema. We often call them glasses. So often we ask the client what you don't like at all. So this is often a typical question. And we ask them, what do you hate? So we ask for, let's say, a very intensive emotional response. And then the question is, what is the first thing that comes into your mind? So, for example, they could say, I'm bad, or no one loves me, or I'm a loser, or my emotions do not count, and so on. So these are the schemas. So if they would say, no one loves me, then we would call the schema, no one loves me schema, or no one loves me glasses. So what we want is to pick up the wording of the client, of the young client, in order to make them better understand what do we mean with schema. So we mean the glasses that I'm always expecting that no one likes me, or I'm excluded, or I'm ignored. So this is our way to explain what a schema is. And you can imagine when a schema is activated, that is really difficult for everyone, also for children, of course. And here on this slide, you can see the most, the 18 schemas. There is a discussion of 2-3 more schemas, but these are the main. Okay, I'm not going into the detail here. I try to pick up the question, what happens when the schema is activated? So usually people have many possibilities, but you can group them. So you can group the coping strategies into 3 groups. This is actually surrender, avoidance, and overcompensation. And it really depends on the model, so the parents, for example, and the temperament, and some learning history, which coping style is applied. And this is actually important also for the schema, because the schema gets perpetuated, gets more stronger and stronger when one of these coping styles are applied. For example, let's say we have a boy who has been forgotten and feels alone. Okay, that might happen. And he's wondering, where are my parents? This is a normal thing. But what happens when this boy has experienced that many, many times and has also in other contexts similar experience? Then he might feel a schema of that is like no one is stable, or I'm alone, or there's no one I can rely on. And the question is then, how does he cope with that feeling or with his schema activation? So for example, when he would overcompensate, he maybe would attack other children. So he's actually sad, he feels alone and abandoned, and he compensates this schema activation by overcompensation strategy, like to attack others. He could also surrender, and then he feels guilty for his vulnerable child mode. So then he's suffering and surrendering and feels guilty. So you cannot see that probably, but you see him sad, or you notice something is wrong, of course. Or he's avoiding. Maybe he activates his detached protector and tries to cope as good as possible, but deep inside, of course, he's hurt and feels abandoned. So these are the coping styles, and also one important point is also the temperament in our clients. So here's an example, the Big 5 model. So here also children are have a certain temperament. So, and this might play also an important role. So let's summarize what might be the problem when children showing any emotional or behavioral problems. We could say there might be a schema activation that is caused by the interaction of temperament and biography. We have usually some risk and also protective factors that will lead to dysfunctional beliefs or maladaptive schemas. And we must add that the family is also very important in which the child is living. But let me say, the parents are also just children of their parents. And even the grandparents were just children of their parents. So what we often find when we do parent work, what we find is transgenerational patterns. And that means we often find family schemas. So it seems to be that schemas can actually transmit it from one generation to the other. And also we must include that the family is also living in a in a certain culture. So this is a important topic from Beatrice. So the culture, sensitive background of families. And that all leads us to the question, how can we help the child best? Having in mind that the children are highly dependent on the parents or on the society. And this is something, a picture I will show you later in detail, but you can see there's an interaction. And we often find schema collusions or mode clashes between children and their parents. And this is, of course, a problem because that makes it more difficult to find healthy coping strategies. Okay, so we mostly work with a mode model. And what is a mode? We could say a state that is in the moment activated. And I give you an example of what belongs to a mode. So we have a cognition usually, an emotional part, a physiological facet, and an impulse to do something. So this is the motoric point of view. And this is like a bundle, very complex, and you cannot separate that so easily. So usually when a mode is activated, you have the whole bundle of emotions, cognitions, and all is activated. And what we try in schema therapy is to use this idea, which stems from the parts work, to integrate that to better understand what is actually between the stimulus and the response. So what's going on in the child or in the client inside? This idea was already used by many pioneers and important researchers. And so here is just a list. I just want to mention the parts work was not invented by schema therapists, but we use the parts work and we call it modes. So we use the mode work in order to better understand the emotions and the needs behind. And that's quite helpful also for children. And I will show you how we do that. In general, we have 4 groups of modes. These are the group of child modes. So for example, the vulnerable child mode. So here the client feels like a really vulnerable, hurt child. We all know that. If someone hurts us, we feel more or less like a child, hurt and abandoned, and this is unfair, this is mean, and this is actually, so that's quite normal to have child modes also in adults. And this is one side, so we feel like a child in certain aspects, but we also have usually some voices or critics or demanders in our mind, and this is what we call the modes of the critics, or the demanding or punishing critics. And these 2 groups are in stress, they are in conflict, and usually the child learns in his life some coping strategies which are more or less surrender, avoidance, overcompensation. Okay, this is the old way and leads to problematic or clinical symptoms. We now try to get a new way. So we try to understand the child modes. We try, of course, also to understand the critics, but more or less to disempower them when they are inadequate. And this is done by the usually clever and wise mode, which is the child version or pendant to the healthy adult mode. And this is what we are focusing on. When we do the mode work, we have certain steps. So for example, we first try to identify the modes. We look to get access to the vulnerable child. We want to work on the modes. We want to understand what the mode's job is, what's the function. And then more or less we go into the interventions, which I will show you soon. For example, let's say when we are working with younger children, this is now, stop my presentation, so maybe you can see me here. This is my dolly. Just see. So this is Dolly. So imagine I have a child, let's say kindergarten or primary school child, let's say 6, 7, 8, 9, 10 years old, and I would present Dolly. And Dolly is a wonderful sheep. You can believe me, everyone loves Dolly. When Dolly goes to the kindergarten, or first, second, first class, or wherever the child is going to, then everyone is fascinated. Do you know why? Because she has so wonderful ideas. And when she's laughing, everyone is happy. And she's also so smart and so lovely to animals. And she really, everyone is happy when Dolly is coming. And also, do you want to touch her? So believe me. And the point is here that we also ask the child, can you imagine what she doesn't like? So we ask the child what she doesn't like. Yeah, maybe when somebody set a limit or tell her what to do. Exactly. This is what she doesn't like. And you know what then happens? Dolly changes actually from being a sheep into a wolf. And all of a sudden, she becomes a wolf. And then she's really angry and hitting and spitting and so on. And everyone is wondering what happened with Dolly. No. However, she was very angry, and after a certain time, she turns into the sheep again. So, okay, there's a zipper, and then you cannot see anything from a wolf anymore. And the crucial question is then, do you know that? Have you experienced that as well? Being happy and all of a sudden there happens something and then you are really, really angry? Yes, you know that. Wonderful. So then there are two parts in you, right? So there's a happy side. Let's say the name is Lisa. There's a happy Lisa and there's an angry Lisa. Is that? Oh, interesting. Thank you so much for sharing that with me. But just wait. Maybe there are more different Lisas. So this is actually how we introduce into the idea of the multiplicity of the self. So sometimes I feel like this, sometimes I feel like this. It's quite normal thing. So we can also share with a child that is happening to me as well. Sometimes I'm really happy and all of a sudden something happened what I don't like at all. And then I feel different. And then I'm in a different mode. So I'm happy mode, and this is an angry mode. And these feelings we can also bring in by using just children books about feelings. This is one way. So we talk about and introduce the feelings to the child. And one mode is the most important one, and this is a vulnerable child mode. So in our understanding, when clients have an experience or have a history of heavy need frustration, then they build up schemas. And when the schema is activated, usually the first mode who pops up is a vulnerable child. So those children who have for a long time problems or who are in some way problem children in general, they often feel isolated, lonely, and so on. So their vulnerable child mode pops up. And this is in schema therapy the most important mode that we want to take care of, that we want to protect, to validate, and actually help to master the next steps or the next experiences or reach the milestones. So this is really important to talk about this vulnerable mode. And another really important one is a clever and wise mode. Again, this is a child version of the healthy adult, and this is actually what all children have. Of course, they are not like adults, but regarding their own life and what they have experienced, they are pretty smart and have good ideas. And this is actually what we try to foster or try to strengthen the clever and wise mode in the child. So what we do is we ask the child to do a mode sketch, and it looks like this slide actually. So we use a flip chart or sheet of paper and draw a big figure, and within this big figure, smaller figures, and the smaller figures are the modes. And this is a preparation, more or less. Here are some examples that helps us later to look for material. The material could be, for example, finger puppets. So what we use is the finger puppet as a represent for the inner mode, the feeling, how we defined it in the mode sketch. And when we have that, you can see, then we also bring in ourselves actually as a therapist. Just give you an example that you have an idea what it is like. So let's say we have a child who's very anxious or is very shy, for example, and this could be like this little chicken. Okay. And let's say we have a child who is also very smart and chooses the owl as a wise mode. And I don't know, maybe there's also an angry protector mode. So let's say this is a finger puppet who is really angry and willing to fight for the rights. Okay, so let's focus on this. And what is quite helpful if you have a figure also for yourself. So I hope you recognize me. This is supposed to be me. And what we usually do is say like this. So let's assume we have here our finger puppets on the table, and then comes a little Chris. So this is me, and then I talk to them. So for example, I would talk to the, let's say, to the angry protector mode. I would say, hello, it's nice to see you. Oh, wow, I heard about your costume and your protection. That looks fantastic. And I would ask the child, could you play this one? So I asked them, could you play this mode? And I play myself, and then we will see what happens. So we have more or less two levels. One is a meta level where we talk to each other, clever and wise mode to clever and wise mode. And this is a meta level, and we prepare or talk about or debrief what happened on the play level. When we use the play level, we are using the puppets and let the puppets talk. And here we play the puppets and try to learn more from them. And this is quite helpful, actually, when we actually externalize these feelings, these needs, and these different modes, then the child doesn't feel so pushed or so, it's not so dangerous or uncomfortable for them. So using puppets that represent modes is a really nice way to talk with them from a certain distance, from the meta level, about certain emotions, about certain needs, and how the mode team is working. So, of course, there's a certain dynamic, and that's best explored when we use the puppets. When you have older clients, so let's say they don't want to play with finger puppets, for example, the adolescents, we often use mode cards. So the mode cards you can see here, they are different pictures. And what we can do here is, for example, when we identify a certain feeling. So let's say I would, now how do you feel? Yeah, I feel sometimes like this. I don't know how to name it or to label it, but that describes my feeling. Okay, and then this is a question, what is a need behind? So why does this here vulnerable child feels actually so hurt? And here we have these cards. Also give you an example why it makes sense to use cards. Because this, just an example. Let's take another card. Let's say the child is very angry, or the client is very angry. And we would say probably behind this anger is a kind of frustration or the feeling of being neglected. And we can actually use these cards to show this is on the top, this is visible, but maybe there's someone behind. And this is possible with the modes, and we can also integrate the needs. For example, when we have a need card like this is approval or self-esteem, it might be that someone is really angry because they are hurt, he or she is hurt because she has a lack of approval, or maybe a lack of protection, and so on. So the cards help us to show there's one is visible, something what's on the top is visible, but there is something behind. And that's actually the story with a basic understanding what's the need behind the symptom. This is a crucial question, and we try to address this question also with our client. So we need their help, and usually we ask them, what would you need in this situation that makes you so angry? I don't know. Can I try to help you to find something? And then we present the need model. And the need model is universal. So every human being has his needs. And in this way, we try to invite them. Maybe I need a friend. Maybe I need someone who takes care here. Maybe I need, and in this way, we go through the need model. So it's quite helpful to have pictures, to use pictures to describe feelings that are unbearable in some way. And of course, we also have a more elaborated form to work with cards. For example, here, stimulus and response. Let's say any situation causes any response. And we try to shed light into the mode black box. So we would maybe ask, how do you feel in the first moment when you are noticing the situation or the trigger is present? Yeah, I feel hurt. Of course, you're hurt. And then, yeah, I'm frustrated. And maybe inner critic pops up and tells me I should behave. And this is childish to feel sad or angry. Maybe I try to distract myself a little bit, but with my smartphone, in the end, I explode and have a hand tantrum. So this would be a possible explanation. What's happening between stimulus and response? And what we usually do is we go from mode to mode with the client, and the client is in his wise mode. He's a boss. She is a boss. She's the leader of the team. And the leader is a good leader when he starts to with some positive thing or some appreciative thing, but also talks to them in a very clear and authentic way. And we help the child, or this is more like for adolescents here, we help the adolescent to find the right wording or the right attitude towards the different modes. And this is especially important here for the vulnerable child modes, that the client learns to be self-compassionate or to take care of the vulnerable child, and don't allow when the inner critic is criticizing. Finally, when we have actually such a track and we have worked out these modes are involved before the problematic behavior comes, is often the question, where do we get the turn? So we need to get the turn as soon as possible, often with a vulnerable child mode. What do you need in this moment? Yeah, I need someone who understands me. Okay, right, that's good. So someone who is listening to you and tries to understand you. And this is actually, yeah, when that happens, compassion, empathy is possible, then the solution is more possible, and I feel better. Okay, I know I'm a little bit over time. I try to make it short. We also apply chair dialogues. I cannot show you. We also work with imagery. So here, trip to the clever and wise mode. So this is an imagery to strengthen the clever and wise mode. Give me 1 minute for the parents. The parents are the most important people, of course, for everyone, also especially for children. And parents need to learn to understand the needs of their children in order to apply or activate their caring and guidance mode. This is how we call that. And what often happens when children are triggered and they have a certain mode dynamic and they activate their dysfunctional coping mode, that this coping mode might become a trigger for the parent. And that's, of course, very, very difficult for a parent because, of course, a parent also feels vulnerable. And when he's not prepared, then he activates any dysfunctional parent mode that he or she has experienced in their own childhood. And that has an effect on the child. So we have here a really difficult interaction, and the parents are important. And that's why we also have a program for parents that takes about 10 sessions, plus minus 5. And we go through them. It's not a schema therapy, it's more a coaching regarding the parenting, healthy parenting, and what they need. Okay, so if you're interested, you can read the book. Beatrice mentioned it in the beginning, so there's an English-speaking book. And we also had recently the World Schema Therapy Day. Maybe you know there's also a 40-minute introduction on video. You can actually activate that for free. And the best thing is, of course, you register in our training in Hong Kong that Beatrice and her team is organizing. So here are some information. So, and if you want to know some certification rules, you can find on the website of ISST. So it is accredited what we do in Hong Kong, so the training. And this is actually the final slide. Thank you very much for your attention. And I'm now open for your questions.
Yeah, thank you so much, Christoph. And I learned something just from hearing this short webinar. And yeah, I'm so interested myself to join in. And really, yeah, I'm glad that you give a little time about the coaching for parents as well.
Mm-hmm.
So now I leave the floor open. If anyone have questions about this course, you can feel free to raise your hand so I can ask you to unmute yourself, or you can type it in the chat box as well. I has posted the link of the course here, so there will be like 3 full days course that Christoph is teaching and will be teaching in Hong Kong. So there will be like lots of content you see that we can't include it in 45 minutes because they're so rich the content. So if anything that you would want to ask, feel free to raise your hand or type in. Or otherwise, perhaps I would ask some questions. So warming up. So if you want to ask, figuring out your question, you type it in and let me know so I would read it out. Yeah. So I'm very impressed with this model and how you link it to needs and how you are using a very child-friendly way to educate. And I see like how this is going to help to build more resources within the child. And one of the things I often hear from my colleagues working with children and adolescents is that they find their client is still in the trauma. So they feel helpless themselves. because they want to like really help them by changing the environment, the context, including their parents. So, how would you position the therapy and the role, and what would be your advice to that idea?
So in the beginning, we usually do a diagnostic. We try to understand what is about, what's the background. If it's trauma, it's a background. We can also think of EMDR or any trauma-specific, trauma type 1 procedures. This is possible, but what we talk about is, actually, we also talk about trauma, but it's more developmental trauma, type 2. So where children don't have this single traumatic event, but they have many or thousands of needs, frustrations, which in the end are also like a trauma. So the first thing is to understand what is the basic problem and what does a child or the family need. So we also need to think of the parents, of course, because we are the therapist and see the child maybe once a week, an hour. That is not much, and the parents see them all the time. So first thing is understanding what is our hypothesis, or what's a disorder, or what's the background of the disorder. And then we start with, to appreciate and to welcome and to really build a relationship that is good, that is stable enough to talk about some shame attacking issues, for example. And this is often what happens. Children feel ashamed. And they do not tell a stranger like me or like a therapist necessarily what they really feel. So if we really want to go deeper and not just be a behavioral teacher or a trainer, if we really want to pick them up emotionally, we really need to invest time to get to know each other. And this is what I would say, no matter if they are if they have a trauma disorder or whatever, it's good for every child to have some space to start slowly, get to know, and then with a very charming or playful approach to talk about emotions. And this is usually our way. So be patient, but yeah.
Yeah, oh, I can't. Yeah, thank you so much. Yeah, because shame is such so deep in our culture as well. So I think you touch on something really important too that will resonate a lot. And yeah, trauma happen in isolation. So the way that you see the child, you already start healing process. Thank you. I see there are two questions, very good question here. So one of it is, may I know what's the difference of schema therapy versus IFS? Both of them appear to focus on different internal roles of a person.
So internal family system is it IFS?
Yes.
Okay. So actually, I would say IFS is also great. It's really wonderful because it also works with the parts. But in schema therapy, we have a broader approach. So we include the schema and the history of the client. We also, I'm not an expert in IFS, but actually we are more broader, take into account different techniques. So also, for example, hypnotherapy or acceptance and commitment therapy, so self-compassionate also therapy. So there, I would say schema therapy is has a broader repertoire from which we can make use, actually. But the mode model is also very much or very similar to the IFS.
Yeah, many you have demonstrated to us many therapy have parts and modes ideas as well. So IFS is one of them. And anything to add on the evidence wise? I'm thinking out loud right here.
So we are still in our kinder shoes, so to speak. So it's difficult to practice some research. The criterions are really high, or yeah, it's difficult to. But actually, we have some studies, and I also have a list of all. If you're really interested, I could send it to you. So send me an email, and I'll send you back the current empirical body. Actually, yeah, what we have is what we don't have is RCT studies. So we have usually single studies or descriptions. Or, so actually what we are based on is the experience of the clinicians. So they are curious, they learn it, they give it a try, and they will notice, hey, it works, it is fun, the children are more open, and it's also nice for the therapist. So the really big argument is give it a try and be your own researcher and look if it works. Otherwise, I can send you a list of studies, and there are some RCT studies, let's say for adolescents with externalizing problems, aggressive behavior, explosive behavior. So there are some, but it's not much. It's not really convincing to a hardcore behavioral therapist. So
Yeah.
however,
Yeah, thank you.
It works, and the fact that I can speak to you is a proof as well that it is quite helpful and yeah, makes sense.
Yeah,
Therapy.
yeah. And I have typed in our contact email, so in case you want us to send questions or seeking some more readings from Christoph, please email us. So let me read out the second questions. So thank you very much for the webinar. I'm wondering if you have encountered any difficulties when introducing the schema and modes to children with weaker abstract thinking or expression abilities, such as children with limited intelligence or ASD.
Yeah. So actually, we try to pick up the child where it is. So we are not looking on the age or what they should know or could do. We are looking at where they are. And we have approaches from 4 years on. So let's say we have a intellectual disability or in an 8-year-old child, we can treat them like a 6 or 5-year-old. So we are coming from the bottom and look how much can they understand. And this is our approach that we try to avoid that they feel overloaded, that it's too difficult or that's not understandable what we present. In so far, we're coming from the bottom and go as far we can go, and the child would understand. And this is also valid, of course, for a 14-year-old, for example, with mental retardation. Or we can treat them where they are emotionally, mainly emotionally. And that is also a help, let's say, for very intelligent, cognitive intelligent children who are emotionally less developed, that we also can help them actually, apart from the cognitive development, to help them to really understand their emotions and to learn more in this field, what they are not so, whatever. What is more difficult for them to learn. And so far, we are very flexible. We have a lot of material and approaches.
Yeah, so I believe Christoph is going to cover that in the course about those
Yes, sure.
new ones.
We will talk about different ages, and yeah, it's good for, by the way, also for adult schema therapists, because in adult schema therapy, you also talk about child modes, and when we try to attract the child mode in the grown up, we better use child techniques actually when we really want to invite the client in his child mode. So insofar, it makes sense to learn the techniques that we apply successfully with children and adolescents when we are working with emotionally blocked adult clients. They are in a way like children when we look on their emotions, and they are sometimes cognitively overloaded, or they also feel ashamed to label certain phenomena, and so yeah, it's actually a separate track. If you're already trained in schema therapy, child and adolescent is a separate track. So you have to go all through, and you won't be bored. And it's interesting, and it's really, I can promise you, it's really worthwhile.
Yeah, yeah. Thank you so much for sharing. Um, I imagine the concrete ideas you may need to go into the class, but Christoph have addressed that that's already considered, because he's training in so many places already. I'm sure this is a question that you have him to you a lot. There's two more questions. So one is, when working with children and adolescents, some of them are often not very engaged, despite having long-standing patterns of mood problems. Some of them are often in denial and claimed they are completely fine. I'm wondering how could schema therapy be used as an approach to engage them? So engagement issues.
Yeah. Yeah, this is often the case that children are not happy to go to the psychotherapist or to talk about the issues. That's actually a normal thing, and we would call that they are detached or they're in a protector mode. So we often call that bodyguard or anyone who's actually keeping the distance. What can we do? We try as good as possible to understand what's the reason, why they are in a detached protector mode. So it's also a way of understanding, but also inviting them to talk about the wall or whatever, however we name it. Best thing is, again, relationship building. Try to make them understand we are on their side. We are highly subjective for their needs, so we are actually, we try to make them understand we are really on your side, but I need to understand. And this is the best way to invite them to lower the wall or to show more of their emotions and to get better committed step by step. But I think the relationship is a crucial thing.
Yeah, yeah. Thank you. Um, because of the time, I'm going to read out the last question, and I think that's a question about registrations that we can actually explain. So I quickly tell everyone here, so Christoph planned to have level 2 and 3 too, after the level 1 face-to-face training. So there's possibility you continue to, if you are interested in accreditation, you can continue to train with Christoph, and we can send our information later. Do you want to add on that? There's
Yeah,
another question here.
we have level 1. This is 3 days in person in Hong Kong, and we will, if we have enough interested participants, of course. We will continue with the rest. So it's level 2, and here we will talk about parent coaching and some deeper going techniques with adolescents and also children. So level 1 provides a good overview how to work with children and adolescents. And so this is in person. The other one is online. It's also well perceived. Most people really like also online. So you can go the track. So you're welcome.
Yeah. So you're welcome. If you're looking for accreditation, you're in the right place. So there's one last question. Do you have time, Christoph?
Yeah.
Do you think you can answer the last one? Okay. So because I know this person has enrolled your class, she says she can ask in your class. So when you discussed educating parents about children's schemas or how to address their needs, I consider children who may not have attentive parents or who reside in hostels or foster homes. Could the role of parents be assumed by teachers, staff, or other caregivers?
Yeah, that's a good question. So if the biological parents are not available for any reason, whatever, maybe they are not known or they passed away or whatever, they are simply not available, then we think about who could meet the needs of the child. And if it could be the teacher, it's too less actually. I would say there needs to have a primary attachment figure here. So then maybe another family member, maybe a foster mother or father, and so on. But anyone needs to feel responsible for the needs of the child. So it would be good if you have pedagogues and teachers who are very compassionate, but actually I would say it's not enough. It's actually, we try to reach the parents and really make them understand the need model. The need model is crucial, is the key to understand what do children need to develop in a healthy way. And this is our primary focus. If that is not possible, we look for other caregivers who could do the job. But the child has a right for his needs, and we feel like a lawyer for the needs of the children or the needs of the family.
Yeah. So the therapist also advocate for the kids.
Yes,
Yeah.
sure. Yeah,
Yes.
advocate of the needs, actually. So some people are asking, when you coach parents that might be in conflict with what the children would need. So we understand ourselves as a lawyer or advocate of needs. And the child has needs. By the way, also the parents have needs, and we try to make them to understand their mutual needs that they find together. And then we talk about family needs. And yeah, the goal is to bring them together, to understand each other, and the parents also in an empathic way to guide their children. So it's not only so it's good to be compassionate, but children also need guidance, but in an empathic way. And this is sometimes difficult for parents. So we try to help them.
Yeah, I'm glad to hear that it's, you so like the unit as a family as well. But I believe it's very applicable in our culture because so much, we are very attached to family and seeing family as a unit. So yeah, thank you so much for today, Crystal, for your generous time, for everyone staying behind to answer the questions. And I'm very excited to see so many questions posing in. I have posted the link here with the discount code as well. So because actually the early bird way has passed, but we create a code for you. So if you have joined this webinar and you find it really interests you, especially for the accreditation path with ISST. So we have this code valid for 1 week time. So hopefully we will see you later in June in person. Thank you, everyone.
Thank you for your attention.
You see the clap, the claps. Yeah, maybe now you have time to read the chat box. Yeah.
Just a little bit, yeah.
Yeah, you see the
many,
response here.
Thank you so much.
Yay.
Okay,
Yeah, people love it. Thank you.
I see.
Yeah. Give it some time for people to express to you. Yeah. And I